So as a chief of party, you were charged with implementing a health information system, a pretty widespread health information system in Gaza and the West Bank. What are some of the challenges you faced that were maybe unique to that region?
Well, the main challenge was this is a new system that was introduced to physicians, doctors, everyone who worked in the healthcare system. And so naturally, much like the introduction of any new system, there comes the big resistance from within to the way in which people are used to doing things. Ordering drugs via the computer, having to work on the system for effective management of patient appointments, registration, diagnosis, etc. And so a lot of it was people-related challenges that we had to face with. But ultimately, I think one of the things that we were able to do is to learn what people want from the system, being able to work with the vendor and the technology provider to be able to address all the concerns and needs and to deliver something that people utilize and effectively use.
Mm-hmm. And how is this project going to affect the future of health systems in the region? I mean, what sort of an impact does it have?
In a way, it's revolutionizing the healthcare system. It's allowing the Ministry of Health in the West Bank and Gaza to treat more patients at less cost. It allows them to save a lot of money in terms of expenditure on pharmaceuticals. And so there are a lot of impact. There is a big impact, not only on cost, but also in terms of planning and governance at the Ministry of Health, how they develop their planning strategies and healthcare management for years to come using the data that is coming out from the HIS is very instrumental.
And where do you see, say, 10 years from now, what's going to be the future of digital healthcare and
healthcare
in the region?
Sure. I think much like the digital revolution have touched almost every sector in the world, I think the healthcare sector is not an exception. We're starting to see a lot of different types of applications, social media, digital marketing come into the picture. And so how do we harness the data that are coming out from people twittering about which hospital should I go to, which physician actually works better than the other. And so even star rating when it comes to healthcare services, I think eventually the healthcare system is going to be reshaped with the types of data that is emerging from social media, from digital media, and so on. And so it's the consolidation of all the information that are coming in and trying to be able to make sense out of the data that is being analyzed. That is going to be very effective.
So what advice do you have for other groups, other chief of parties who are maybe doing something similar in nearby places?
Mm-hmm. So one of the things that I think a lot of people fall in, the trap that most people fall in, is that they focus on technology and not people. And my advice is that invest in people, get competent team, put together a competent team that is able to deliver, and then think about the technology and the tools that you want to use. And focus on put a system that has and puts the patient at the center, and then build all the services around them, because at the end of the day, the health information system is supposed to serve patients and patients only.